Malaria remains one of the deadliest diseases in Africa because it affects millions of people yearly. But the good news is that it is preventable and treatable. Please stay glued to the end of this video as we will discuss malaria, what causes malaria, symptoms and practical ways to protect yourselves and your loved ones from malaria. Malaria is caused by a plasmodium parasite, which are transmitted through the bite of an infected female Anopheles mosquito. When these mosquitoes bite you, they inject the parasite into your bloodstream, and this leads to malaria infection. There are different types of plasmodium parasites. We have Plasmodium falciparum, which is the most common one and the deadliest in Africa. We have others like Plasmodium vivax, Plasmodium ovale, and Plasmodium malaria. These ones are less severe, but it doesn't mean they are not dangerous. Please note that malaria is spread by mosquito bites, not by drinking dirty water. Okay, now let's look at why malaria is very, very common in Africa. In Africa, we have a lot of rural areas where malaria thrives because malaria thrives in places with standing waters, and this is where mosquitoes breed. Factors like poor drainage systems, unprotected sleeping habits, and lack of awareness increases our risk of getting infected with malaria. Now let's look at some common risk factors. Common risk factors are living in mosquito-prone areas like rural and swampy regions, not using your mosquito nets or your mosquito repellents, poor sanitation and stagnant water, weakened immune system, especially in pregnant women, children under 5 years, and the elderly ones. Now that you know mosquito breed in stagnant water, please eliminate every form of stagnant water around you. There are some symptoms of malaria that can appear within 10 to 15 days after a mosquito bite, but recognizing them early can help to save your life from malaria. If you have malaria, you will experience symptoms like high fever and chills, sweating and headaches. You will have muscle aches and fatigue. You easily feel weak. Then you'll be experiencing nausea, vomiting and diarrhea. Then in severe cases, there can be convulsions, organ failure, or it can even slip into coma. If you notice any of these signs that I just mentioned, please get tested immediately by visiting the nearest healthcare center around you for a blood test for malaria. Testing helps you to confirm if it's malaria or if it's another sickness or illness with similar symptoms like malaria. Malaria diagnosis methods are a rapid diagnostic test, which is RDT. This one is the quickest and the simplest. Then a microscopic blood smear to confirm the type of malaria parasite and the severity of the infection. Remember, prevention is better than cure. So here is how you can protect yourself and your family from malaria today. You should try and sleep under insecticide-treated mosquito nets, ITNs. You should use mosquito repellents and protective clothing when you are going to sleep at night. Eliminate stagnant water around your home. Install window and door screens and also mosquito nets on your windows to help prevent malaria. Take preventive medications, especially for people that are traveling or people that are high-risk individuals for malaria. If you are diagnosed with malaria, start your treatment immediately because a delay can lead to severe complications. Now let's look at some treatment options for malaria. The first treatment option is an artemisinin-based combination therapy, which is the ACTs. These are the most effective treatment for malaria. Then we have anti-malaria drugs like chloroquine and quinine for severe cases of malaria. Then a supportive care using fluids, pain relievers, and hospitalization if is needed. Please ensure you take your treatment in full doses and don't try to skip your medications. Use it to avoid any form of resistance. Now let's look at how you can use a good diet to speed up your recovery from malaria. Eating a balanced diet and staying hydrated plus resting well are crucial for your recovery from malaria. Foods that are rich in vitamin C, iron, and protein help to rebuild your strength after malaria infection. The best food for malaria recovery are leafy greens because they give you an iron boost to replenish lost blood. Fruit that provide you with vitamin C for immunity. Then lean proteins, they provide strength and repair of worn-out cells and tissues in your body. Please remember to drink lots of water to prevent the dehydration from malaria fever. Malaria is preventable, treatable, and curable. By taking the right action, we can protect our families and our communities from malaria. Please, let's spread the awareness, use mosquito nets, and eliminate breeding grounds for malaria. If you found this video helpful, please like, share, and subscribe for more health content. Drop your comments in the comment section about malaria. Let's continue spreading the awareness.